Breast milk. The World Health Organization is among those organizations that says newborns should receive it for at least 6 months. But sometimes moms simply can't generate enough milk. So what's a family to do? Well, I got answers from UConn Health Lactation Consultant Marissa Merlot and Naomi Baryam, Executive Director of Mother's Milk Bank in Northeast.
So briefly, a milk bank is a service where mothers donate extra milk that they have. We screen the mothers and pasteurize the milk, and we dispense it primarily to fragile, premature babies.
So how do we determine what extra milk is? If a mother's sitting at home thinking, oh, maybe this is something that I could help with, how does a mom determine if she's making extra milk?
So the best way to determine it is when there's no room for the ice cream in the freezer. The people pump, and mom really needs to feel comfortable that it is extra milk. And sometimes we get calls from moms who start the screening process and then go back to work and say, you know, I really want to hold on to this milk until I see how it goes. And the milk always goes to the mother's baby first, and it's really only what she considers to be extra that we will take.
So it's mom's discretion, really?
It's at mom's discretion, absolutely.
Marissa, for you, the UConn is opening a milk depot. How is that different from the milk bank?
So at UConn Health, we're going to serve as a depot, which is essentially a place for moms actually to bring their milk that they're able to donate. We collect it from mom and then actually ship it out to the milk bank to be processed and pasteurized in order for them to send it back out to NICUs across the region.
Got it. And then if there is a mother who is thinking that they are not able to make enough milk, should they contact the hospital, or is only for these NICU babies?
We do send milk to outpatients at home, so they can contact us at Mother's Milk Bank Northeast, and we can walk them through how they would get the milk. They will need a prescription from the baby's provider.
And so that doctor has helped the mom to determine you actually aren't making enough milk for your baby. How, you're a lactation consultant, how long do you work with a new mom or to determine breastfeeding is for her, or she in fact does need a little extra help?
So I work with moms beginning in the hospital setting when they first deliver. So most moms now who deliver are only in the hospital from anywhere from 2 to 3 days. Not a ton of time to establish their milk supply or even to determine if they're going to have a high supply or a low supply. So the advantage actually at UConn Health is we do outpatient visits as well. So some moms can continue to come to me for days, weeks, even months at a time. So we have ongoing evaluation to determine their needs.
So the CDC and the World Health Organization both recommend that a mother be breastfeeding for 6 months. That's right?
Exclusively for 6 months, and then thereafter along with other foods.
Why 6 months? What do we know about the nature of having that food source for a baby for that length of time?
Endless, actually. We probably don't have enough time to go through the benefits of breast milk
Really
for
good
the
stuff.
baby. It is obviously the best nutrition for a newborn. It is made by a human being for a human being. The most beneficial nutrition, easiest for them to digest, benefits in the immediate infant newborn period, and benefits lifelong for both baby and mom, actually.
So you're saying it's really great for mom and baby, but I think there might be people watching this thinking, is that safe for my baby to drink another mother's milk?
So that's a really good question. And there's two basic answers. One of them is that the alternative of formula is milk from a cow or a soybean. So you have to have some perspective on what you're comparing it to. And when we donor milk, mothers are very carefully screened for health issues. It's modeled after blood banking, and it's a very detailed screen. We actually ask additional questions even beyond what blood banking does. And the milk is pasteurized, so that anything, we pasteurize in such a way that we get rid of pathogens at the same time as we're holding on to all of those wonderful nutritional and immunologic and brain growth factors in the milk.
Nothing's lost in the pasteurization
Something
process.
is lost in the pasteurization, but we try to lose as little as possible while getting rid of all of the pathogens and the bad stuff. But something is lost, and that's why our goal is always to have mothers feeding their own babies so that they don't need us anymore.
And so if someone's thinking, okay, freezer's full, there's no room for that ice cream, I do think that I'm making extra milk. Are there health benefits or excuse me, health criteria for that person who's donating that they need to go through in order to be eligible to donate?
So broadly, if they are basically healthy, they're probably fine. Because we're modeled after blood banking, there's certain travel restrictions depending on where they did their junior year in college kind of question. We have a lot of detail on our website. We probably don't have time to go through it all now, but we have detail on our website of what the qualifications are for a donor, and then give us a call.
So why did UConn come to this concept of a milk depot now?
So my background in nursing actually was working in a NICU. I was a NICU nurse at UConn Health for 12 years. So I have firsthand seen the benefits of both mom's own breast milk and donor milk to enhance the health and lives of these premature babies. So I think it was that personal connection, also being tied into the March of Dimes. I have a very close friend who actually donated her milk. I wanted to help the community have a closer and easier method for them to donate.
Is there a charge for families who use the service?
Who receive the milk? Mm-hmm. There is. We charge essentially for the milk is donated, so we're not charging for milk, but we do charge processing fees because even though we're a small nonprofit, the electric company really doesn't care that we are, and we still have to pay our electric bills and our rent.
So what would a family expect to pay if they were going to use the donated milk? So
the donated milk comes to about $4 an ounce, which sounds very costly, especially when you have a full-term healthy baby.
Do we have any sense of how that compares to if a family were to choose to use formula instead?
Formula is probably about 20 or 30 cents an ounce. It's a lot less.
So this is more expensive, but again, you're saying the health benefits are sort of outweighing.
And the idea is to use, particularly for outpatients, is to use the donor milk as what we call a bridge to mother feeding her own baby. So even at $4 an ounce, the idea is that mom is mostly feeding her own baby and needs a little bit of help while she's bringing in her milk supply, in which case the cost is not that high.
So still working with the lactation consultant sort of in tandem with this.
Exactly. Absolutely. It's part of breastfeeding support.
I read something that you wrote, and you said, quote, "Each small bottle contains milk, hope, support, and encouragement that touches each person in its path from donor to recipient." Why did you write that?
It does. It really does. It's what we've learned is that using donor milk not only has all of those wonderful immunologic and nutritional effects on the baby, but what we've found is that when moms use donor milk, they actually need the donor milk less. It does provide that support. It's sort of an integral part of breastfeeding support. And when moms are feeling very discouraged that their supply isn't coming in or that whatever it is, that this is part of that hope and part of that support that will send them on their way so that they are breastfeeding on their own. And we do have moms, not very often, but certainly often enough, who receive donor milk either in the hospital or immediately after they get home, who call us 3 months later and say, "My freezer's full, I want to give back." So it does work.